Yes,
term?
cryopreservation is the fancy medical term for egg freezing, but cryopreservation means you could be freezing eggs, you could be freezing embryos, you could be freezing ovarian tissue, you could be freezing sperm. Cryopreservation just means cold storage or freezing, preserving fertility by freezing. That's a fancy word, but it's freezing. Now, there is one problem with the word freezing. That implies you're making ice, and of course, ice expands. That's why ice cubes float to the top of your soda and they don't sink because when you make ice from water, it expands because the molecules of water crystallize, and there's greater space between the molecules. So an ice cube is lighter than water. But that expansion, if it happens inside your cell, and 70% of your cell is water, of all your cells in your body, 70% is water. And so the reason you, say, die from being frozen or your cells die is that water, which is 70% of what you are, freezes, and that's the word for it, freezes and expands. So by cryopreservation, we can be removing that water from the cells so that we don't kill the cell when we lower the temperature to freezing levels, or we can simply put in a cryoprotectant at high concentrations, freeze very quickly, instantly, 23,000 degrees centigrade per second, and that way you don't form ice. You don't form ice cubes inside your cell. What happens is the water just turns to glass. And so we call it vitrification, and we don't harm any of these cells. So that made it possible to successfully freeze eggs because we couldn't freeze them before, and we can freeze embryos with almost 100% success without hurting those embryos. We can freeze ovary tissue for cancer patients or women who want to save their ovary, and we can certainly freeze sperm, can freeze testicular tissue very, very safely nowadays with these methods.